In Zimbabwe, an estimated 3,000 women die every year from complications during pregnancy or childbirth, and approximately 30,000 children die before they reach their 5th birthday. That's why 6 United Nations agencies have come together in a joint initiative called H4 to reduce maternal and child mortality and improve service delivery to ensure that no woman dies while giving life and that every child has the chance to survive and grow up to realize their full potential.
If you note that over the past decade of 2000 to 2010, Zimbabwe experienced severe macroeconomic situations, meltdown, which affected the health delivery system of the country. And we had health indicators going down. For example, we had an increase in maternal mortality ratio. We also had very poor child health outcomes, including under 5 infant mortality and neonatal mortality. So because of that, there was a need to respond to those the poor health service delivery system which had happened over the decade.
H4 is working in 6 of the hardest to reach districts where health indicators have been extremely poor, representing 11% of the total population.
Most of primary health care activities should happen in the community. Even if you look at the 3 delay model, in terms of maternal mortality. The first one, whilst it's individual, where the woman might not have the knowledge that she needs to go to the health facility. The second delay also involves the community itself, where the community should mobilize in terms of transport, in terms of resources, so that the pregnant woman can go to a health facility for care, even the child who is not well, even for the HIV program.
The Women's Action Group encourages the involvement of men in matters addressing maternal health as we play a key role in the well-being of our wives.
We were taught on the benefits of early maternal booking and risks that follow if we fail to do so, which may include losing a life.
The community is now more aware about sexual offences, gender-based violence, and we are seeing an influx of those cases that are now coming to light.
Rise, Zimbabwe, rise. Now is the time. Time is now. A time for action. Let us say no to child abuse. Let us say no to early marriage. A big no to betrothal of girls. Girls, rise. Rise, girls. We are the color of hope. We are the future.
What the H4 agencies decided to do is to concentrate efforts in hard-to-reach areas, zones in which they may have a difference. This mainly in the area of service delivery.
Through the H4 initiative, nurses were enrolled into an emergency obstetric and neonatal care training program where we were taught life-saving interventions that address the most common causes of maternal death.
In cases of eclampsia, most people used to be afraid to administer magnesium sulfate, but after the training, we can now safely give the drug.
Having undergone emergency obstetric and neonatal care training, nurses and midwives now have the knowledge and confidence to attend to cases of obstetric emergency, such as that of Hajine Masao, who suffered terrible complications in the past, losing 3 of her children during childbirth, but has now delivered her newborn daughter Nyasha safely. This is my second successful delivery of 5 pregnancies. In previous pregnancies, my babies died as they either came feet or arm first, as this one did. This time, the nurses were able to assist me into a safe delivery by cesarean section.
Undergoing EMONC training has been an eye-opening experience and has enabled us to understand the obstetric complications that may occur during childbirth.
The EMOC services are such which require trained personnel, you require commodities, you require a lot of, infrastructural support.
Prior to receiving a new delivery bed courtesy of H4 we had been using an old bed which had deteriorated in use and quality due to rust, threatening the safety of the patients here at Goredema Rural Health Center.
There are some district hospitals, for example, in Mbire district, where they were not doing cesarean sections, and now the hospital has been equipped the H4 hospital, and they are able to do a cesarean section.
H4 Plus has capacitated and ensured that need-based infrastructure strengthening has been completed. The idea behind clinical mentorship was to support the initiatives or interventions on capacity building as it plays an important role in maternal health.
Clinical mentorship is the training that we underwent at Gweru Provincial Hospital in order for us to come back and work in the operating theatre at Gokwe North District Hospital. Before we went there, we had a tough situation because most of the procedures were transferred.
We can now afford to scrub and take the surgeon to do cesarean sections, cataract extractions, and the MVAs.
Clinical mentorship and supportive supervision have the same objective of reinforcing the skills of trainees, while supportive supervision further aims to observe and guide trainees as they apply skills gained on beneficiaries.
There was a senior, someone who was from Gokwe South District Hospital. She came here helping us. She said, Moyo, you are the one to scrub today. I want to see how you are going to do it. I said, sister, I fear not, because you are there to help me. You will tell me what to do. I prepared my packs. I put them in order. I moved my trolley to the table. That's when my first day when I got the confidence that I can scrub, I can do a cesarean section.
Zimbabwe is just one of the countries that has demonstrated the impact of the H4 Plus initiative on women's and children's health. Through harnessing the collective strengths of each agency, tackling root causes as well as immediate needs, it is already delivering real and long-lasting change.
We definitely have had an improvement since 2012. The fact that a woman does not have to travel 200 kilometers where there might be no transport, they are now able to get this service within their community.
H4 Plus has walked hand in hand with the government and the people of Zimbabwe and is going to walk together as long as needed, securing the health and well-being of children and women in the new era of sustainable development goals.